Hello everyone, my name is Francesca Ayers. I'm a registered nurse that works on a labor and delivery unit in the Shenandoah Valley of Virginia. I'm also currently a student at Liberty University to obtain my master's in nursing education. As a labor and delivery nurse in a rural area, I'm very passionate about maternal health care, and I'm here to share a piece of legislation that recently went through the Virginia General Assembly. Maternal health outcomes remain a critical public health concern in the United States, with pregnant and postpartum individuals, especially those who are part of a vulnerable population, facing significant barriers to consistent and quality care. Maternal mortality continues to be a public health challenge in the United States, despite significant efforts to improve outcomes. In comparison to other high-income nations, the United States continues to see an upward trend in maternal deaths. According to the Virginia Department of Health, the state's maternal mortality rate is higher than the national average, with a disproportionately high rate among African American women and residents of rural areas. These disparities are compounded by the fact that 30.8 of Virginia counties are classified as maternity care deserts, areas lacking both hospital-based obstetric services and qualified obstetric providers. These gaps in access increase the risk of undetected complications, poor outcomes during and after pregnancy, as well as adverse infant outcomes. Although some states have been able to decrease its maternal mortality rate in comparison to the national average, Virginia has not passed significant legislation in recent years to improve the rate of maternal mortality in the state. RPM refers to the collection of biometric data without direct hands-on care from the clinical team that is then used to inform clinical decision-making. RPM typically occurs outside of a healthcare facility, and data is transferred to a healthcare provider in another location. RPM can include monitoring of a patient's weight, blood pressure, heart rate, pulse ox, or blood glucose, as well as treatment adherence monitoring through video conferencing services or asynchronously through telehealth platforms. In response to persistent disparities in maternal health outcomes and limited access to prenatal and postpartum care throughout the state, Senate Bill 758 was introduced. Virginia Medicaid currently only covers remote patient monitoring for pregnant individuals classified as high risk, excluding many who could still benefit from the service. Recognizing the limitations of VA Code 32.1-325, state lawmakers sought to expand coverage to include all pregnant and postpartum Medicaid members, regardless of risk status. This shift reflects a growing recognition that risk stratification alone does not capture the complexity of social determinants of health that affect maternal outcomes, especially among racial and geographic subgroups. Evidence from recent literature strongly supports the integration of RPM into maternal care. Disparity in accessing maternal health care among vulnerable populations can be alleviated by implementing telehealth technologies into practice. Peel et al. Found that the use of RPM during pregnancy was associated with improved prenatal engagement, reduced unscheduled visits, and increased patient satisfaction. Butler-Tobey et al. Demonstrated that RPM reduced the number of in-person prenatal visits without compromising outcomes, making care more convenient and cost-effective. They also found that utilizing RPM increased patient satisfaction among participants and decreased prenatal stress. The scope of this issue extends beyond individual health outcomes and touches on critical economic, social, political, and ethical dimensions. Economically, investing in RPM may offer long-term savings to the Medicaid system by reducing the need for high-cost interventions later on. RPM has demonstrated substantial cost savings potential in U.S. maternal care, making it a compelling solution beyond just high-risk cases. In a recent cost-effectiveness study, RPM for postpartum hypertension reduced hospital readmissions from 3.7% to 0.5%, generating an average savings of $145 per patient. While this study focused on a specific population, other research supports broader application. For example, a study conducted in the Netherlands involving women at risk for preeclampsia found that remote patient monitoring led to an average savings of $844 per woman, a 19% reduction in total costs compared to a traditional care. Applying these findings to Virginia, where approximately 37,000 of the 92,000 annual births are Medicaid funded, a combined per-patient savings of $989 could translate to over $30 million in annual savings. These figures suggest that Senate Bill 758, which would expand RPM access to all pregnant and postpartum Medicaid recipients, could yield substantial fiscal and health system benefits for the Commonwealth. Senate Bill 758 is ethically grounded in the nursing profession's commitment to promoting health equity and protecting vulnerable populations. The ANA's Code of Ethics provides a strong foundation for evaluating the ethical dimensions of this legislation. Several provisions of the code directly support the goal of this bill and underscore why nurses should advocate for its passage. Provision 1 emphasizes that the nurse's responsibility is to treat every patient with dignity and respect, regardless of their background or circumstances. Denying access to RPM technology to low-risk patients, especially those in rural, underserved, or economically disadvantaged areas, can unintentionally devalue their care and compromise maternal health outcomes. Senate Bill 758's aim is to prevent this inequity by removing clinical eligibility requirements, thereby promoting more inclusive and respectful care for all pregnant individuals. Provision 2 states that nurses must prioritize the patient's interests and collaborates with others to ensure high-quality care. From an ethical standpoint, expanding RPM promotes beneficence by offering proactive tools to identify and respond to complications early, improving outcomes for both mothers and infants. For example, remote monitoring can allow timely detection of blood pressure changes, reducing the risk of severe complications that often arise in patients who otherwise have limited access to care. Provision 8 calls on nurses to collaborate to protect human rights and reduce health disparities. In this context, Senate Bill 758 is a direct response to persistent maternal health inequities, especially among African American women and those living in maternity care deserts across Virginia. RPM serves as a bridge to overcome geographical, financial, and systemic barriers that disproportionately affect marginalized communities. By supporting policies that close these gaps, nurses fulfill their ethical duty to promote social justice. Provision 9, which states nurses should advocate for social policy that promotes health and human rights, further reinforces nursing support for Senate Bill 758. Maternal mortality is not just a clinical issue, it's a public health crisis rooted in structural inequalities. This legislation represents a concrete opportunity for nurses to influence state policy in a way that reflects the core values of the profession. As a labor and delivery nurse in rural Virginia, I care for many patients who travel long distances to access basic obstetric care. Many of my patients live in maternity care deserts and drive over an hour for prenatal appointments. Some patients skip their prenatal appointments due to lack of transportation, work conflicts, or child care responsibilities. Incorporating RPM under Senate Bill 758 would allow us to extend care to these patients more consistently and proactively, without requiring frequent long-distance travel. From my perspective, this technology is not about replacing in-person care. It's about meeting patients where they are and making sure no one is left behind. In my professional experience, even a simple blood pressure check could help us catch early signs of complications and prevent emergencies that too often unfold in our delivery rooms. For patients in these rural areas, RPM isn't a luxury, it's a lifeline. Additionally, I feel that supporting policies that improve maternal health aligns with the biblical call to care for the vulnerable and uphold justice. Proverbs 38:8-9 urges, "Speak up for those who cannot speak for themselves, for the rights of all who are destitute. Speak up and judge fairly. Defend the rights of the poor and the needy." Senate Bill 758 reflects these values by aiming to reduce disparities in prenatal care and ensure that underserved populations, particularly those in rural areas and those facing economic hardship, receive the support that they need during pregnancy and postpartum. Ensuring access to remote patient monitoring is not only a matter of clinical effectiveness, but also one of moral responsibility. Expanding Medicaid coverage in this way honors the dignity of every mother and child, protecting life and health in this season of profound vulnerability. This bill represents a critical step towards addressing the maternal health crisis in Virginia by expanding access to remote patient monitoring services for pregnant and postpartum individuals enrolled in Medicaid. Although the bill ultimately died in the House during the 2025 session, its failure underscores the urgent need for more robust legislative planning, particularly around financial implementation and long-term sustainability. Policymakers must clearly define funding mechanisms, especially as Medicaid reimbursement expansion remain politically contested issues in Virginia. In future legislative sessions, Senate Bill 758 or a similar version should be introduced with clear budgetary frameworks and expanded support from stakeholders across both the healthcare and policy arenas. Nurses and other healthcare professionals must remain engaged in policy-making process, using their frontline expertise to advocate for interventions that save lives, reduce disparities, and ultimately improve maternal health outcomes across Virginia. I'd like to credit Slides Carnival for the presentation template and Pixabay for the photos. And here are the listed references. Thank you so much for watching.